The sun rises every day. The Rohingya from Myanmar wake up in the makeshift camps in Ukhia, Cox's Bazar, a southern coastal region in Bangladesh. The Rohingya wake up dusting away the rapes, murders and destruction that they had gone through in their homeland, the Rakhine state in Myanmar. For centuries, the Rohingya, an Indo-Aryan ethnic minority, lived there since the 2nd century AD. In 1982, General Nevin stripped citizenship of the Rohingya, depriving them of their basic human rights, including health, immunizations, and education. Myanmar Army unleashed Dragon King expedition, resulting in an exodus of 200,000 Rohingya to Bangladesh, followed by 250,000 people in 1991-92 and many more in 2012 and 2016. The most recent exodus of 680,000 Rohingya into Bangladesh, a country the size of Iowa State in the United States of America, was precipitated by a military crackdown in August 2017. After a militant attack on a small border station, since August 2017, 10,000 Rohingya were killed in Rakhine and their houses were burnt down. UNHCR, the UN Refugee Agency, calls this the fastest growing refugee emergency in the world today. The Rohingya refugees in Bangladesh are called forcibly displaced Myanmar nationals. They are taking shelter in these crowded makeshift camps in Bangladesh to save themselves from the oppression of the Myanmar army. The physical and mental trauma experienced in Myanmar, the exertion of the long journey, including crossing the Naf River, and systematic deprivation of healthcare and vaccination for decades have exposed the Rohingya to fatal health risks. There are reports of outbreaks of deadly diseases such as diphtheria, polio and measles, which have already claimed innocent lives in the camps. The government of Bangladesh and international organizations have been doing an outstanding job by promptly providing vaccines, healthcare, food and shelter. But limited resources make it difficult to sustain these efforts for long. As a first step to provide primary healthcare services, HAEFA, a US-based non-profitable healthcare organization known as Health and Education for All, has organized 2 free healthcare centers in Kutupalong and Balukhali Rohingya camps. Since October 2017, each month, HAEFA provides treatment to more than 7,000 patients in the camps. HAEFA follows a simple 4-step process that begins with patient registration by recording their name, picture, and additional information. All these information are then linked to a digital health card that contains barcodes. Each patient is given treatment based on their weight, height, blood pressure, blood sugar levels, and other facts relevant to that individual patient. The treatment record is stored in HAEFA's NEROG electronic medical record system, which is operated by an innovative solar panel charged battery, laptop and a Wi-Fi router that connect the handheld electronic tablets of the health workers. Every evening, medical records from HAEFA's NEROG system are sent to the offices of the Cox's Bazar's civil surgeon and the Director General of Health Services. This paperless digital healthcare system NEROG can only be accessed by authorized healthcare professionals. Any patient who has once received healthcare services through HAEFA doctors will be able to retrieve their records for any future treatments.
Since beginning of October 2017, we have been providing medical services to the displaced Rohingya population in Kutupalong and Balukhali regions in Cox's Bazar. In addition to free health screening and medicines, we are also providing them referral services by utilizing local health providers such as Upojila Health Complex, Dot Center and feeding centers for malnourished children. We have been seeing a lot of bullet injury and other injury cases, sexual assault victims and severely malnourished men, women and children.
In addition to providing free treatments to pregnant women, children, elderly people and patients with high blood pressure, diabetes, asthma, tuberculosis, HAEFA arranges for referrals in the camps. For more serious patients, HAEFA helps with their hospital admission.
ಗೊತ್ತು ಎಲ್ಲಿದೆ ಕುರ್ಮಾಸಂದ್ರ ಬರ್ತಾಯಿದ್ಕೇನು ಎಲ್ಲಿನೇ ಎಳೆ ಗುಲಿ ಮಾರೇರ್ ಹಾಡೆ ಸೀರೇರ್ ಎಳೆ ಗೊತ್ತಾನೆ ಭಾರಿ ಎತ್ತಲ್ಲ ಜಾಮರಿ ಮಾತಿದ್ದಿ ಬಿಯಾದಿ ಜಾಮಯ್ಯ ನಾಯಿ ವೈನೋ ನಾಯಿ ಜೋರು ಮಾತಿದ್ದ ಬಿಯಾದಿ ಜಾಮರಿ ಮಾತೆ ಆಗಿ ಗಿದ್ದಿ.
I am inside the Rohingya camp. It is an extreme difficult situation, and if someone has not seen it by their own eyes, it will be very difficult to visualize what is the severity of this crisis. We are beside them and giving our electronic medical system for their medical care, and we hope to continue for the next few months or as long as it is possible.
A mother is running to a HAEFA healthcare center with her sick child.
দুয়ার ফুরা দি ফেলাই ফুরা দিবা দে আর কষ্ট করি ওরে বাংলাদেশ ফারাই রায় বা ধরে হসপিটাল গলাই ঘুমাইছ ধরে গলাই রে দাবাই ওষুধ দিয়ে রে খাবাই রে কারাম কি.
People have the basic right to live a normal life. HAEFA works to ensure healthcare and a healthy life to the oppressed, underserved and displaced communities across the globe. That is why we are working for the world's most persecuted ethnic minority, people who have been made homeless and without a country, the Rohingya, by giving them access to free, quality healthcare as long as they need it. HAEFA wants to empower the underprivileged through health and education. We want to see a healthy world. We want to make the world a better place.